So glad to have you join us back at Rise and Shine, this midweek edition at Spectrum Television, coming to you from the beautiful hills of Ibiako Red. And today we've been talking about something very critical, something that is of great importance to the girl child and, of course, the male child. A health concern that we all have to work together if we have to put an end to the scourge. And right here in the studio, we have a guest, an expert who is more than qualified and proficient to handle all of the questions that are begging for answers. But at this point, I'll ask you to connect us on our socials at spectrumtv.ng to tell us and join the conversations and get to contribute to what we have to discuss this morning. At this point, I'll let Otto do the introduction.
Auto, like you mentioned, makes me remember how my mom calls me.
Oh my.
A medical doctor has joined us on set. She is the consultant physician and an outreach coordinator at Medical Women Association of Nigeria, Akwa Ibom State Branch. I'm talking about Dr. Tiema Afabio. Unique name it is.
Thank you.
Just sit down and love Tiema. You know. Wow. Good
Eh,
morning, and
Good
thanks for joining
morning.
Good
us.
morning.
Thank you. It's a pleasure to be here.
Okay, I would like us to start off on the right foot. Let us
Okay.
in on everything about cervical cancer, most especially the ones that are not really in public space. I know subjects like this are most times discussed on what cancer there, but I mean, with the severity of this condition and the widespread, you would agree that we wouldn't have to wait for once a year to talk about it. So, what's new about cervical cancer?
Okay. Well, it's a very topical issue, and in fact, we need to talk about it every day
Mm,
because women are really going through a lot with this disease. It's a leading cause of death among women, especially in the developing countries,
mm,
and it's like the third commonest cancer in the world. So that's very, very huge burden of disease. But let's say nothing much has really changed about cervical cancer. It's usually still the basic things that we have always known,
mm,
that this cancer is actually the cancer of the womb. If I'm to put it in a layman's term, the womb is where the woman carries the baby. So that part of the body is where this cancer, cervical cancer, starts from. And what's the issue with cancer? The issue with cancer is that it doesn't just stay where it starts, it spreads to all parts of the body and then causes a lot of problems, eventually kills the person. So that is the major burden of cancer. What is the cause? Most people want to find out what's causing this cancer among our women. It's basically a sexually transmitted cancer. It's caused by a virus called human papilloma virus, and this virus is transmitted sexually. So usually, by the time a female is exposed to a sexual intercourse, she could get this virus, and if she's infected with this virus for a very long time, she could come develop cervical cancer later on in life. So that's why we are always trying to prevent that exposure from happening, and that's by vaccinating young girls against this human papilloma virus. And there are certain risky behaviors too that can expose a young girl to this cancer. If the girl is having sex at a very early age, for instance,
mm,
some young girls, 10, 12, they're already exposed to having sex. So it's too early and the body is not developed enough to fight off all those um, viruses and stuff. So
mm,
at that time, it's very likely that she will contact the virus and likely that she will develop cervical cancer later on in life. And then
mm.
also promiscuity. You're not just having sex with one person, you're having sex with multiple partners. The risk is very high that you're going to get this virus. Um, because a lot of people have the virus actually. Some people, it may not cause any problems, but some people would be unfortunate to come down with this disease. And also, having multiple children, giving birth too many times,
Mm.
yes, it's also a risk factor. Like we have observed, medicine is science. We observe and we record data. So
What do you think in that regard could be the reason for that?
well, still the same thing, maybe multiple exposures,
Mm.
Yeah, multiple exposure.
But this time with one partner, because I guess for someone
It's
to have
possible.
plenty.
It's possible with one partner. It's possible with multiple partners. You
Mm.
never can tell. Yeah.
Okay, so doctor, you've mentioned the fact that it can also happen to women who have given birth too many times.
Yeah.
Now we recall that in our mother's days, back in those days, we used to have women give birth to 10, 12, and thereabout children.
Yeah.
But we didn't really used to see this scenario. What then changed that we are now having it on the increase?
Hmm. Well, I don't think we didn't see. Maybe we saw, but we didn't know what it was because most of those diseases were not diagnosed. They usually say, "Oh, she was sick or something. She just died." But women those days, yes, they used to have 7 children, 8, 9, 10. It's not advisable. It's advisable for a woman to have 4 deliveries, and that's fine. But after 4, you are grand multipara in our medical language. You're going above the line. So, well, I can't say whether it used to happen or not. I can't say.
Mm.
Okay, you made mention that for some people they could have the virus and it's just there,
Yes.
and for some people, they could die out of
Yes.
that. So, what's the difference? Why should one person have the virus and can leave? It doesn't have any effect on that
Yeah.
person, and another person has the virus and is, endangered.
Oh well. Let's say personal differences, genetic differences. You never can tell. But the risk is increased in all those other situations I mentioned already. Promiscuity, early intercourse, and all that. And then also people with HIV, if they have a depressed immunity, anything that disturbs your immunity, disturbs your ability to fight off diseases, disturbs your ability to fight off a virus. So that virus has the chance of replicating in the body and have the chance of developing cancer in the future. So there could be subtle differences, yes, but we never really say because these are risk factors. I'm not saying it has to
Yeah.
be cause and effect. No, they are risk factors. So
Well, let me take you from this angle. The highest rate of contacting cervical cancer is through sexual intercourse,
yeah,
and by that it means that the male folk do have this
of
virus.
course, definitely.
What's the difference? Why would the male have it and it doesn't have any effect in them, and the
It
female
does.
have it? It does. Okay, so let us in on that.
Okay, it does. In the male counterpart comes down with prostate cancer. Yes, comes down with prostate cancer. The female comes down with cervical cancer. So it's a two-way thing. It's a two-way thing. So
Mm.
So
and
why then do we have the disease burden more on the female side than we have men coming down with prostate cancer?
I don't think that's true. A lot of men have prostate cancer. A lot. In fact, well, yes, maybe you can say that men are not as sick as the women because the women may not detect on time, and by the time the disease is noticed or they have any symptoms, it must have spread to all parts of the body. So the male may be able to know on time that he's not feeling very well, and his own is much slower progression and may not really kill him as fast as cervical cancer, but it's there. It's a very topical issue on its own. So maybe we'll talk about prostate cancer.
Mm.
Okay, so as a coordinator with M1, I know M1 does a lot of things that has to do
Yeah.
with cancer, breast, cervical, and prostate. Recent now, you talked about before we get to the issue of vaccination, though.
Okay.
As a girl child growing up, what are the likely symptoms that you witness or you notice in your body, and then you have to, be concerned about getting diagnosed and probably, getting the treatment?
Treatment.
Because we from research we've discovered that one of the things is a woman having a heavy flow. But then, medically, we've been told that not all heavy flow would amount to cancer. So, at what point would a girl child begins to get concerned about
Okay.
stuff like that?
Okay. Well, when you contact the virus, it may not have any symptoms. So that's why screening is important. From the age of 21, every girl should screen for the virus and screen for cancer. But by the time you developed cancer of the cervix, you definitely have some symptoms as the disease progresses. For instance, the bleeding you talked about. Irregular bleeding means that this bleeding is not the usual bleeding you've had. Some people have heavy flow, yes, but sometimes you bleed when you're not supposed to bleed. You've attained menopause, you've not seen your period for a very long time, suddenly you start bleeding. That's abnormal. So when you see that kind of abnormal changes, you should be worried to go check what's going on with the bleeding issue. And then also you could have pain during sexual intercourse because the cervix is just there, and anything that affects the cervix could lead to pain during sexual intercourse. And then also discharge. If there's a discharge, a funny looking yellowish or smelly or something, you should see a doctor actually. That by that stage is actually very late to even see. So most times we don't emphasize wait for the symptoms. You don't wait. Every lady has to have a pap smear. The pap smear is a type of screening for cervical cancer. Every 3 years at least. Every 3 years, go get the pap smear.
But at what age does a girl child begin to get worried? Because most times when we have issues like this, medical issues, they say, oh, it has to be from women between the ages of 30 upward. So at what age should we start getting scared, okay, over cervical cancer? And does cervical cancer as well have stages?
Yes, yes, definitely. It has stages. Um, for a girl child, like I said, we should not wait until she's getting into her 20s to get vaccinated. We vaccinate young girls, 10, 11, they should get vaccinated. But for the screening and all that, by the time you're getting to 20, 25, you should start getting worried, as in get screened every 3 years at least. So, for the staging, it may not really concern us per se for the audience. It's a medical diagnosis. You don't stage by yourself. You have to go to the doctor who will take the biopsy and then stage it. So by the time it gets to the early stages, those things are curable. The early stages are curable if they do surgery, if they give drugs or take out the womb, the person may get cured. So that's the importance of staging. The early stages are curable, but by the time it gets to the late stages, stage 1 to 4, by the time it gets to stage 4, it's very late. And 5 year survival may be like 20% of people may survive at 5 years.
Okay, so
Yeah, let me come in with that follow up on that. You said staging, and now you mentioned that at the point where you see the symptoms like the smelly discharge and some of those
You may already be late.
you're already late.
Yeah.
So what are the early signs that could say, okay, this is the stage I am now?
There are no early signs.
Mm.
Yeah.
So, if there are no early signs to help the girl child understand that, okay, you're getting to a crisis situation, now, how long does it take for the different stages for cervical cancer to go from stage
Stage
one
to
to
stage.
stage four?
It takes a pretty long time. It takes a pretty long time. Natural history, it's about 10 years.
Mm.
Yes, about 10 years. But if you do the screening, that's why we emphasize the screening. If you do the screening, you'll be able to pick it in between somewhere. If you do it every 3 years, you pick it somewhere along the line. So it's if you pick it early, it's fine.
Okay,
Oh
so
well.
one of the things like we rightly know is the fact that means cervical cancer is being transmitted sexually, and that means the male child plays a vital role in
Of
the
course.
situation of the female child.
Definitely.
Now we know that vaccines have been introduced in some parts of Africa, but in Nigeria, it is yet to be made a routine vaccination.
Yeah.
So my question is, are the male being vaccinated as well, or would the male be vaccinated as well?
No.
Why so?
Oh, it,
So if the males are not being vaccinated and we are the reasons behind
The
the
transmission.
transmission, how
mm.
then will we be able to effectively curb the spread of cervical cancer and help the female child?
Oh well. Um I think the vaccine has been developed for the specific stereotypes that cause cervical cancer. So for now, we're not vaccinating the male child. We're vaccinating the female child. And I can't really put my finger on it right now why we are not vaccinating the male child. Maybe I'll try to do more research on that. Um, maybe the risk of transmission is not very high from the female to the male. Maybe.
Okay,
I'm just
but
thinking.
one male is capable of infecting like 5 females.
Yeah.
I think that they're the people that should be vaccinated the
Reason
more.
one should be vaccinated
No,
as
because
well.
if we want to also go by what she said, that naturally a woman can actually just have cervical cancer. And is it cervical cancer now? Yes. And it's just that. So it doesn't really have any effects, while another person might have it and it has an effect. So maybe it's likely that we're just born with some kind of symptoms. Is that so?
Can you confirm that?
We're just born with some kind of symptoms, just like they'll say that what's this now? This growth in the womb,
Fibroid.
fibroid. Yes, that every woman has fibroid somewhere. You know.
Is it the same? Is that the case?
No.
Absolutely. So, are we looking forward to having the male folk vaccinated anytime soon?
Possible.
Or would you chant a curse for that?
I would.
Well, we'll put a pause here and go on a short time up. When we return, we'll be wrapping up with this particular segment. Please stay. Glad to have you back. Yes, the show is still Rise and Shine Wednesday edition, reaching you live from the beautiful hills of Ibiakuran. And we still have Dr. Tiema Akpabio in the studio, who is giving insight to the issue, the health condition of cervical cancer. And yes, we've talked about the symptoms and all that is. Doctor, at this point, let's talk about the remedy. What's the way forward for females? How accessible is the vaccines you talked about?
Okay, the vaccine. Okay, that will be prevention.
No prevention, absolutely.
Okay. The vaccines actually are available, but they're not free. It has to come at a cost to the patient for now, until we can get some donations, or if the government wants to take that up, the government can actually immunize young girls, like they are also immunizing babies against other diseases. So the government can also do that. So we actually call on the government to please take care of our young girls and help them live a life free of cervical cancer. So for treatment, actually when you get diagnosed with cervical cancer, it's not a death sentence. There may be options for you, as will be decided by the doctor. The doctor might decide to do a surgery. For instance, if the woman has had all her children, he can decide to take out the womb and then maybe give some drugs, and the woman will be cured of cervical cancer. Remember, we said the earlier the better. If the disease is diagnosed at an early stage, the chances of cure are very high. But if it's diagnosed at a later stage, it may not be very high. So the important thing is to get screened. All women from ages 20 and above should get a pap smear done at least once every 3 years. And if you're over the age of 65 years and you've had your pap smear has been clean all along, you may not need to worry. As we get older, the chances of developing cervical cancer are much, much lower. So yeah.
You've made it clear that the vaccine would have to come at a price unless otherwise subsidized by the government, or
Yes.
there is one NGO somewhere taking care of the bill. But then, how readily available and accessible is the vaccine to the common person? Are there some designated places one could go to, or is it available at every medical facility?
It may not be available at every facility, unfortunately. I only know of one facility apart from our secretariat. I know there is one at the Quinto Pharmacy. He has some vaccines, but you have to pay. I don't know exactly how much. And even at our secretariat too, we have to pay for them.
Okay, I think it brings us to the point where we talked about earlier on that for those that do not even have the money to buy to get the vaccine, it's going to be trouble for them. But I also wish that the federal government could be more proactive, just like they were during the COVID-19, and see
Yeah.
cervical cancer as something that is very key. It's a global concern, like we said earlier.
is.
We're looking forward to that as well.
So what are your moves? Have you spoken with some NGOs? I know like that FAREP is pretty much concerned with issues with women.
Yeah.
Have you tried, approaching FAREP for some sort of
Yeah, definitely. I know we have approached FREREP, but I would need to go back on that to be sure what their response was regarding the vaccination.
well,
I would need to confirm that.
well,
Is there
we-
also constant education to women and girls about this?
Yes, we're trying our best. There's so much we can do. We're trying our best. We do outreaches once in a while. We go out, talk about it. In World Cancer Day, we did a lot of enlightenment. We talked to women about this. And we also look out for partnerships and sponsors. These things cost a lot of money to organize. So whatever we can do, we will do our best to ensure we reach out.
Okay, so me, I'm more concerned about the fact that, I mean, in as much as there's a price tag on the vaccine, the inavailability of the product
Yes.
for any person who possibly has the money to purchase it is of great concern for me. So,
Yeah.
I mean, is your organization, or are you aware of any move by any government agency or group of persons to ensure that, I mean, we could have these vaccines more readily accessible across the nation, across the state?
Okay. Well, for now we don't have here, but we had some donations from Ecobimo Ibia Foundation from the USA. We had some donations of the vaccine, which has actually run out now. So we are looking forward to more collaborations like that. We would actually do more to ensure that it's available.
well, we cannot but wish you luck on that. That you you have more donations, more collaborations, and partnerships that would help with the supply of the vaccines, as well as funds to reach out to young girls in terms of awareness. But well, this is where we call it today. I want to thank you very much for being on the show. You have such a unique name, Tiema.
Tiema
So as you
Akpabio.
go, Tiema Aquabio, thank you very much. So this is it for the first.